Afternoon, everybody. Sorry I'm late. Good to see you. Thanks, everybody, for being here. I have a couple of announcements I'd like to make, and then I'm happy to take any questions that you may have. I also want to thank my colleague, Mark Anthony Middleton, for being here today, my city council colleague. First of all, I want to say we all take this coronavirus incredibly seriously. If you have not had a chance to see the message that I put out yesterday for the residents of Durham, please do so. It talks about social distancing, the importance of social distancing. It talks about the measures that we've taken so far as a city and a state to protect Durham. And it also lays out particularly what we all have to do to keep ourselves safe individually, and makes this most important point. Each of us must act so all of us are safe. That's the most important lesson that we can all learn from this. We all have to act individually if we're to keep our community safe. One of the things I will say about that is that's an opportunity. That's an opportunity because everybody can participate in helping to keep our community safe. Sometimes people want to know, what can I do? There is something you can do. You can socially distance, and that in itself is a significant contribution to keeping our community safe. To that end, yesterday afternoon at 4:15, I issued an amendment to my declaration of the state of emergency for the city of Durham, and that amendment for the city of did a couple of things. The first thing it did was, I think they're recording me back there. The first thing that it did was that it ordered that all gyms, fitness centers, health clubs, and theaters will cease operations on their premises effective at 5 o'clock today. I don't take that step lightly. We know that every kind of prohibition, whether or not it was what the governor did when he closed down restaurants and bars, except for takeout, or the decision I made last week to shut down the DPAC and other city facilities, we know that these things have huge impacts on people. So this was not a decision that I took lightly, because I know people's livelihoods are at stake, but people's lives are also at stake. People's lives are at stake. And if we don't act now, more people's lives will be at stake. Those societies that have most successfully fought the coronavirus have acted early. What we don't want to have happen is that we will look back 2 months from now or 3 months from now, when this virus might be ravaging our community, and say to ourselves, I wish we had done more, I wish we had acted earlier. I want to note that this order does also provide for the fact that any of these fitness or health clubs can offer fitness or health instruction and programming through virtual access and streaming services to patrons, clients, and other members of the public. There are health clubs that are doing this right now all over the country, and we also have the opportunity here in Durham for our health clubs to be able to offer these virtual instruction. We also provide that gyms, fitness centers, and health clubs are being used to provide child care services on their premises to aid the city's response to the COVID-19 virus shall be authorized to remain open for the limited purpose of providing that child care. Why did I include that provision? One of the most crucial things that we are facing right now is the deep concern nationally, but here in Durham also, that we are able to support our frontline medical workers. And one of the biggest threats to being able to support those frontline medical workers is the fact that our schools are out, and many of them have young children, and we may need to be providing child care for those children of critical healthcare workers and other critical workers in the city. If we do that, we may need to be doing that in cooperation, particularly with our local YMCA. it would fall under this prohibition, except that we have made this special provision in case that we need emergency child care to be taking place there or elsewhere. There is another provision that I think has been little noticed in this declaration, but let me talk about it now. We have in Durham companies which are doing work that will contribute to fighting the coronavirus. And some of these companies want to expand their work. And in order to do that, they may need to expand their footprint. And in order to expand their footprint, they would usually have to go through a laborious site plan process. So what we have done with this declaration is to put in the hands of our planning director, Pat Young, the ability to invoke authority that we have in our Unified Development Ordinance that would allow him to waive and suspend or cease enforcement of the UDO related to site plan approvals specifically related to people working on the coronavirus. So, for example, we have companies in Durham that are working on tests that may need to expand. And if they do, we don't want to delay that by having a laborious site plan process, so we have delegated this authority to our planning director. Not in this order is one other thing that I want to talk about today, something else, another step that we have taken that I also don't want to, that I want to say that we don't take lightly. Because again, this is affecting people's livelihoods, and we know how significant that is. The governor determined that farmers markets could be treated like grocery stores, but the farmers market here in Durham is at Durham Central Park. That is a city facility. And what we know about that facility, what we know about the farmers market, is it is specifically designed to have hundreds of people come and congregate at the same place. And I love the farmers market. I love to go and congregate there. I love it. But it's to have hundreds of people deliberately come to the same place in a small area and shop. So we have made the decision, and I am absolutely confirmed in my belief that this is the right decision, to cancel the farmers market for tomorrow. We have told, and I will be our administration has told, and I will be in contact personally with the farmers market folks this coming week, that if they can design a pickup and delivery system, much like our restaurants have, where crowds are not gathered, but there can be pre-orders and pickup and delivery where people don't have to get out of their car and can come up and pick up their vegetables, I'm certainly open to that, so that those farmers can continue to at least make some living during this difficult time. And I think that there are a lot of people who would take advantage of that service if we offered it. But the congregation of crowds is exactly what we don't need in terms of spreading the coronavirus. So those are the decisions that I have made, as I say, I don't make them lightly. And I want to now offer any of you all the opportunity to ask any questions that you might want to ask.
Mayor Josh Chapin here at Channel 11. It's weird. Just a weird time. We're all sitting apart. It is weird. I asked this given what Durham went through last year. We're almost a year removed from the natural gas explosion downtown. And a lot of businesses seemingly are still recovering from that. How do you weigh that? And given everything that you're doing, given other businesses are not over what happened there last April?
Yeah, thank you, Josh. If you all don't mind, and Tony, if it's okay with you, I think we'll just ask people to ask their questions without the mic. Is that all right with everybody? That way everybody doesn't have to share a mic. Yeah, thank you. Josh, great question. Yes, there are businesses in Durham. There were several businesses in Durham that were badly affected by the gas explosion that we had last April. And some of them are still recovering. You're absolutely right. I've heard from a couple of those businesses. as the governor said when he made the decision about restaurants, this is a decision that we cannot take lightly, of course. Other mayors, the Mecklenburg County, other mayors around North Carolina are making these same decisions about gyms and health and fitness clubs, but it's not something that we take lightly. Here's what I would say to the businesses that I think is really important. The longer we wait, the greater our chances are that the virus will have wide community spread. The more people who are here who will get sick and die, and the longer the disruption to their business will be. Our ability to keep the disruption to their business less depends on us acting early. There's no question that is the experience that we've heard from around the country and around the world. Those societies that haven't acted quickly and effectively haven't been able to do that. Bill?
Yeah. Could you repeat the question so that
Sure, I will.
viewers,
Yeah.
can be watching this social media?
Yes, I can.
In some states and municipalities, they've gone to more stringent,
Tony, we're not going to use a mic, okay?
they've gone to more stringent restrictions on shelter-in-place community.
Yeah.
Do you have the authority to do that in Durham, and have you considered anything that restrictive?
So the question was, have I considered shelter in place? And the answer is that I don't know anybody who's grappling with this situation in a serious way, who is in a leadership position in a city or a county who is not actively thinking about shelter in place. You see it beginning to sweep the country in the areas where the virus is growing. And so have I thought about it? Absolutely. One of the difficulties about shelter in place is it's very hard to do that on a local basis. If you live in a region that is as interlaced and interlocked as we are, it's hard to imagine a shelter in place order in Durham that would work only here and not, because people are driving in from Raleigh every day. They're driving in from Chatham County, Roxborough, and Chapel Hill. Our folks are going there. I think that we will need either a regional or a state approach to that, but I'm certainly open to thinking about a local decision if that needs to be made. And I've talked this morning with members of the governor's office about what they're thinking about that is. It's an ongoing conversation, and one of the things I can say about this is anything that anybody says yesterday is different today and will be different tomorrow. So, yeah.
If I can just follow up, do you think that it is necessary now on a regional basis?
I think that I'm still evaluating that. I think that I'm listening to the public health authorities, and I'm evaluating that. I do think that if we're not there now, we will be getting there. That's my opinion. And exactly when that takes place, we have the first transmissions in the state that are community spread, and I think that we're heading in that direction.
I have a two-pronged question. The first is, do you think that the governor should be instating a shelter-in-place statewide? And then secondly, are there any other measures that you feel you can legally consider as far as other ways to restrict the amount of people out in Durham that you might be considering?
So the first question is, should the governor be considering a shelter-in-place statewide? And my answer is yes, he should be considering it. And I've spoken to his office today and previously about that. I know that the governor is thinking about these things very carefully. I think he's done a great job so far and made some tough calls, but they were the right calls. And so I'm looking forward in the next, continuing that discussion with the governor's office. I spoke to the governor yesterday himself about it. And the second part of your question, Sarah, was, are there other actions that we could take? Yes, there are other actions, and I expect that we will be taking other actions. There are other counties in North Carolina that have been restricting other activities, especially where people are in very close proximity, and I'll be considering those very carefully, as I'm sure our county health department and director will as well. We would like to work in concert with our county health department and director. It's important. Anybody else?
Mayor, since we're streaming this, we're allowing reporters to ask questions.
Yeah.
I emailed, this question is from Amy Jeffries. She's with WUNC. And she wanted to know if you could address what the city and local law enforcement have been doing thus far to enforce restrictions on bars, restaurants, and mass gatherings.
Sure.
Have any citations been issued?
I don't know that any citations have been issued. I certainly haven't heard that, but that doesn't mean it hasn't happened. I have not heard of any. But my understanding, first of all, many of the bars and restaurants, by the time that the governor issued his order, had already made the decision to go to takeout only or to close down. That had already happened. As far as I know, we've had voluntary compliance in almost every other situation. I know there have been a few times where our police officers or the sheriff's department has felt like they needed to say to folks, especially some people were serving outside, but people were still congregating, have said to say, you can't do that. But my understanding is enforcement has not been a problem. Yeah. Mm-hmm.
I wanted to ask about the terrorist I don't know if you addressed this yet, but what is the latest?
Yeah.
Hotel
Mm-hmm.
going back,
Sure.
given everything.
Yeah. Josh has asked about the McDougal Terrace residents. There are still McDougal Terrace residents in hotels. They have been going back, some have been going back every week. But there's still a significant number of hotels. I don't want to give an exact number, but, and that is, I know that our Housing Authority, Anthony Scott, who I spoke to about this yesterday, anticipates that in the next week, about 70 more families will be going home. So we're getting to where there are fewer and fewer who are still in hotels. That's a big concern, especially with school out. And so that continues to be a major concern for our community. The coronavirus only heightens that concern. And so, yes, that's very important. Other concerns related to that, the Durham Housing Authority has several senior facilities, Price Steel Place, J.J. Henderson, Oldham Towers, and we're of course very concerned that because seniors are especially vulnerable to the coronavirus, and there are many people in these facilities who have other health problems that would increase their risk. We're very concerned that the Housing Authority get the support that it needs in order to keep these folks safe. And they've been in contact with the health department and so forth. But it is a major concern. Anytime you have a congregation of older folks in one place, it's a concern now. I'll just mention one other concern, a related concern that we have, is that with our homeless population. When you think about this, so if you are a person who has symptoms and you go to the hospital and you are tested, you then need to go home and quarantine until the results of that test are in. But there is no home for a homeless person to go to. They can't go back to urban ministries, for example, where we have congregant living and they would not be able to socially distance at all. And if you're a homeless person who has presented, has been tested, and you've been found positive, you've tested positive, and after you have tested positive, you need to be quarantined. If you don't need to be in the hospital, but you've tested positive, you still need to be quarantined. So there are two groups of people amongst our homeless population who will be needing, not may be needing, will be needing quarantine facilities. And that's something that we as a community have got to figure out. And this means individual rooms where people can be food can be delivered to them, and they will be able to be provided with medical checkups. There are a lot of good people working on this problem right now. Representative Price, Congressman Price, has a very important role in building the legislation that's coming out now in Congress. One of the big three bills for that Congress is going to pass in this next week. One of them already passed. And one of them is going to contain the housing funding. And one of the big aspects of this housing funding, according to Representative Price, and he and I spoke to him this morning, is that we are hopeful that we will be receiving federal assistance to help us provide this quarantine, because it will be expensive. And that is going to be in the bill, I feel certain, because Congressman Price has such an important role in the writing of this bill. Any more questions?
What's your sense of the actions at the Durham County Jail to try to protect the population there that's so far? I feel like none.
So I will say that a lot has been done. I'm not sure about the detail, and I think that question is probably better directed to the sheriff. But what I will say is that the jail population has been reduced. But you're raising a very good point. People who are in our jails are at high risk of coronavirus. And when they get out of our jails, then they're at high risk of spreading coronavirus to other people. And so it's very important that we minimize that exposure. And part of what that means is having only people in the jail who need to absolutely be in the jail because they're violent and can't be anywhere else. But I know that the sheriff has taken good steps in that regard. But I think your question is best addressed to him. Any more questions? Thank you all for coming. I appreciate it very much. Thank you. Hey, Bill. Good to see you.